Welcome once again to Tools in Anesthesia and Critical Care, the online orations for learning through seminars. In this edition, we shall refresh and discuss regarding the American Society of Anesthesiologists Physical Status Classification System. Let me remind you that you can pause the video at any moment to review the contents of the slides and proceed. The ASA Physical Status Classification System was initially created in 1941 by the American Society of Anesthetists, an organization that later became the ASA. Why do we need a physical status classification? This is an important tool to evaluate the degree of a patient's sickness or physical state before selecting the anesthetic or before performing surgery. This helps in communicating between the colleagues, for allocating resources, for record keeping, and to create a uniform system for statistical analysis. It may be noted that the grading system is not intended for use as a measure to predict operative risk. This is the overview of the ASA Physical Status Classification that we all know. ASA 1 will be a normal healthy patient, ASA 2 a patient with mild systemic disease but without functional limitations, ASA 3 a patient with severe systemic disease with substantive functional limitations, ASA 4 a patient with severe systemic disease that is a constant threat to life, ASA 5 will be a moribund patient who is unlikely to survive with or without the surgery, and ASA 6 a declared brain dead patient whose organs are being removed for organ donation purpose. The addition of the alphabet E denotes emergency surgery. Now let us look into each classification grade. Who constitutes ASA Physical Status 1? It will be a normal healthy patient, no organic, physiologic or psychiatric disturbance. He or she should be non-smoking, no or minimal alcohol use, and all the extremes of age are excluded from ASA 1. So the example, a healthy patient with good exercise tolerance will be ASA 1. Coming to ASA 2, a patient with mild systemic disease, no functional limitations, he has a well-controlled disease of one body system. The example would be a current smoker, social alcohol drinker, normal pregnancy. That is, a pregnancy is a condition with physiological derangements, but it is well compensated, but definitely there is pathological potential. So ASA Physical Status 2 is assigned to normal pregnancy. Obesity when BMI falls between 30 and 40, well controlled diabetes, hypertension, mild respiratory disease. These would be the examples of ASA 2 physical status. Coming to ASA 3, a patient with severe systemic disease, there will be some functional limitation, has a controlled disease of more than one body system or one major system, but however there is no immediate danger of death. The example would be poorly controlled diabetes or hypertension, COPD, morbid obesity when BMI is higher than 40, history, that is before 3 months and before of myocardial infarction, cerebrovascular accidents, coronary artery disease with stent in situ, etc., moderate reduction in the ejection fraction, end-stage renal disease patient undergoing regular scheduled dialysis, premature infants with post-conception age less than 60 weeks also categorized into ASA Physical Status 3. Coming to ASA 4, a patient with severe systemic disease that is a constant threat to life. he or she has at least one severe disease that is poorly controlled or at end stage. Possible risk of death is also mentioned when we discuss ASA 4. Example would be severe, that is within the last 3 months, myocardial infarction, cerebrovascular accidents, coronary artery disease with stents, ongoing cardiac ischemia or severe valvular dysfunction, ejection fraction reduction is severe, patient in sepsis, disseminated intravascular coagulation, patients with end-stage renal disease not undergoing regularly scheduled dialysis. All of these would be examples of ASA 4 physical status. ASA 5 will be a moribund patient who is not expected to survive with or without surgery for more than 24 hours. There is imminent risk of death. The example would be ruptured abdominal or thoracic aneurysm, massive polytrauma, intracranial bleed with mass effect, ischemic bowel in the face of significant cardiac pathology or multi-organ or system dysfunction. This will be ASA 5. Coming to ASA 6, a declared brain dead patient whose organs are being harvested for donor purpose. It may be noted that the anesthetic responsibilities while handling ASA 6 patients are well beyond ethical considerations. The addition of the alphabet E denotes emergency surgery. Now the question is, what would be an emergency surgery? An emergency is defined as existing when delay in treatment of the patient would lead to a significant increase in the threat to life, limb or body part. So when an ASA 1 patient comes for emergency surgery, the grade will be ASA 1E. For completion's sake, let me state a few limitations of this classification system. It doesn't consider the risk inherent to the planned surgical procedure, and there is a lot of inherent subjectivity or inter-rating variability. Somebody classifying a patient as ASA 2, another anesthesiologist might classify him as ASA 3. It's all about finding the reasons why you are placing the patient into such and such category. So this is one tool where we use to communicate between colleagues regarding the preoperative status of the patient. So this is regarding an overview regarding the ASA physical status classification. You can log into our Facebook page or YouTube for the earlier editions of Tools in Anesthesia and Critical Care, the online orations for learning through seminars in anesthesia and critical care. It's me, Saneesh, signing off. Thank you once again and bye-bye.